1. All articulate with the zygomatic bone, except which? A. Frontal. B. Temporal. C. Lacrimal. D. Maxilla. E. Sphenoid. The answer is C. Lacrimal. 2. A bone lies anteriorly in the cranial base, contributing to the medial orbital walls, nasal septum, roof, and lateral walls of the nasal cavity. A. Sphenoid. B. Frontal. C. Maxilla. D. Vomer. E. Ethmoid bone. The answer is E. Ethmoid bone. 3. Singular viscerocranial bone. A. Palatine. B. Maxilla. C. Mandible. D. Ethmoid. E. Nasal. The answer is C. Mandible. 4. All are features of normallateralis of the cranium, except A. Temporal fossa. B. Zygomatic arch. C. Mastoid process of temporal bone. D. Zygomaticofacial foramen. E. Lacrimal fossa. The answer is E. Lacrimal fossa. 5. Bones of the head can be considered unique based on the following characteristics, except A. Function. B. Number of foramina. C. Presence of air-filled sinus. D. Type of joint. E. None of the above. The answer is E. None of the above. 6. The abducent nerve leaves the skull through the A. Inferior orbital fissure. B. Superior orbital fissure. C. Foramen ovale. D. Foramen rotundum. E. Jugular foramen. The answer is B. Superior orbital fissure. 7. Most commonly fractured cranial fossa. A. Anterior cranial fossa. B. Infratemporal fossa. C. Middle cranial fossa. D. Mandibular fossa. E. Temporal fossa. The answer is C. Middle cranial fossa. 8. All are visible features of the inferior aspect, norma basalis, of the cranium, except which? A. Incisive fossa. B. Coine. C. Mandibular fossae. D. Cristogali. E. Pterygoid processes of sphenoid bone. The answer is D. Cristogali. 9. Not a part of the crescent of 4 foramina. A. Foramen spinosum. B. Superior orbital fissure. C. Foramen rotundum. D. Foramen lacerum. E. Foramen ovale. The answer is B. Superior orbital fissure. 10. A craniometric point located at the junction of the parietomastoid, occipitomastoid, and lambdoid sutures. A. Bregma. B. Asterion. C. Glabella. D. Aenean. E. Tyrian. The answer is B. Asterion. 11. All of the following passageways are present in the posterior cranial fossa, except which? A. Foramen magnum. B. Condyloid foramen. C. Carotid canal. D. Hypoglossal canal. E. Internal auditory meatus. The answer is C. Carotid canal. 12. Which one of the following boundaries of the orbit is formed mainly by the orbital plate of the ethmoid bone? A. Base. B. Roof. C. Medial walls. D. Lateral walls. E. Apex. The answer is C. Medial walls. 13. All of the following arteries supplying the face, scalp, or both arise directly from the external carotid artery, except one. Which is the exception? A. Superficial temporal. B. Posterior auricular. C. Lacrimal. D. Facial. E. Occipital. The answer is C. Lacrimal. 14. Part of the dilators of the mouth widens the oral fissure as when grinning or grimacing. A. Levator angulioris. B. Levator labii superioris. C. Zygomaticus major. D. Risorius. E. Depressor labii inferioris. The answer is D. Risorius. 15. All muscles are related to the nose, except A. Percerus. B. Nasalis. C. Buccinators. D. Depressor septi nasi. E. Levator labii superioris alique nasi. The answer is C. Buccinators.